Welcome to our course introducing you to the 7 service standards that are a part of In This Together. Now, click Next to begin the program. In this course, you'll learn about the 7 service standards that are a part of In This Together. You'll learn what our service standards are and some best practices for how you can demonstrate them in your work here at Planned Parenthood. Regardless of your role, using these service standards will help ensure positive outcomes when interacting with our patients, community members, and with each other. Let's begin this introduction of our service standards with a brief review. In This Together is a powerful way to talk about who we are as an organization and a movement. It has 3 components: our service ethos, our 6 workplace values, and our 7 service standards. Our 6 workplace values describe the kind of people we are. Values are the pillars of our culture, defining how we behave and work. They act like a GPS to help ensure we're moving in the right direction and stay true to who we are. We use these 6 values to guide the decisions we make every day. Service standards are concrete actions we can take and behaviors we can demonstrate that will help ensure positive and productive outcomes when we interact with and serve others. Many of us already demonstrate these service standards in our work. The goal is to use them with every person, every time. Whether you work with patients, donors, advocates, or other staff, the service standards help ensure those you interact with feel heard, cared for, and respected. This results in improved patient satisfaction scores, better retention, more referrals, and improved health outcomes. Teamwork and communication will be improved, making our jobs easier and more satisfying. Imagine the possibilities if we all demonstrated these service standards with every person, every time. Let's go deeper now and learn about each of the service standards and how using them will help us in our jobs. Clear the slate means that we start each encounter free of negativity from anything that's happened earlier. We remove distractions and are present. This is important because every patient, client, and colleague deserves our full, undistracted attention. Here you see 4 best practices that can help you clear the slate. We can't provide quality work when we're thinking about something else. Take a moment to move past any prior experience, such as your last meeting or previous patient encounter, so you can be fully present. This can be as easy as taking a few deep breaths. Second, it's important to remove distractions. People will feel more respected and listened to when they have your full attention. For example, keep your phone out of view and silence notifications. Third, be aware of your judgments and biases when beginning an interaction. People will not share their needs if they feel judged by us. Lastly, acknowledge your state of mind if you're having a hard time clearing the slate. That can be as simple as saying, "I apologize that I seem distracted. Thank you for allowing me a second to gather myself. I want to give you my full attention." Make a connection means we connect with the people we're working with in a way that conveys our expertise, trustworthiness, and accessibility. This allows people to listen to and comprehend the information we share, be motivated to follow through on next steps, and continue to work and partner with Planned Parenthood. Click each box to see how we make a connection. Click the Next button to continue once all the information has been reviewed. A warm, friendly greeting helps break the ice and builds trust. When interacting with others, make them feel welcome by smiling, making eye contact, and by stating your name, role, and expertise. Conveying your expertise helps others feel confident in you. People will not automatically assume we know what we're doing. Sometimes we have to state it. For example, you can state, I have worked with a lot of people with similar concerns. Dressing professionally and wearing your name badge also helps establish your credibility. Identifying the core issue ensures that we can meet people's needs. Ask about their biggest concern and reflect back what you hear to ensure you understand. People may not automatically assume we have their best interests in mind. We have to show it. By saying, I want to make sure we find the best possible solution for you, you tell others you can be trusted and are here to help. How would you handle this situation using Service Standard best practices? Follow the directions to answer. Keep them in the loop means we engage people by sharing what is happening and what they can anticipate. It means we share all information possible to allow them to have control of their decisions and their health. One best practice to keep others in the loop is to give realistic expectations of time. Always explain the reason for any delays and give options. It's also important to explain the purpose of procedures and policies. If you don't know, ask. Explain with every person, every time. Remember, while we may have explained something many times before, it may be the first time this person really hears the reason and purpose. Keep people informed about what happens next. People are less agitated and worried when they know what to anticipate. Lastly, recognize and state if something is outside of your role or expertise. Say, I'm not an expert on this topic, but I will find you an expert. Confirm the plan means we do all we can to ensure people understand the information we've shared with them. They are clear on what will happen next, and they have identified strategies for moving past any barriers that might arise. Click each box to see how we confirm the plan. Click the next button to continue once all information is reviewed. A first step in confirming the plan is to ensure people understand our recommendations. A simple way to do this is to ask them to restate their understanding of what you've shared with them. Next is to identify next steps. Involving people in this process will help ensure their buy-in and increases the likelihood that the plan will be followed. Asking about potential barriers to the plan is a recognition that people have complicated lives. It's best to know upfront what might go wrong. For example, what may get in the way of you following through on your plan? Finally, once barriers have been identified, by problem solving together to address those barriers, we help ensure a successful outcome. We want to make sure people's questions have been answered and that they're satisfied with the care or services received. Asking for feedback is also an important way that we express the workplace value we try and we learn. So we inquire what can be done to make the next time better. Here you see some of the ways we can ask for feedback. Sometimes people wait until the last moment to ask their toughest questions. By asking, "What other questions do you have for me?" we help ensure they get all of their questions answered. Ask what we can do better next time, not just when someone complains. This lets others know we want to create a great experience for them. It's an important way to learn what we're doing well and what needs improvement. Always ask or remind people about their next appointment or next meeting time if applicable. Why? This is another way we show we care and are here to help. Finally, ask if they'd like to refer a friend or colleague to Planned Parenthood. We want to ensure others are aware of and have access to the great services we offer. Positive word of mouth is one of the best referral sources we have for patients, employees, volunteers, and sponsors. Acknowledge the reality is an important way that we express the workplace value. We respect and honor all people. We're committed to creating an inclusive environment where people can bring their authentic selves to work, to the classroom, and to the examination room. We recognize the greater social context in which people operate and live. We know that challenging life circumstances may impact a person's willingness or perceived ability to live out the next steps of their plan. Real people have complicated lives. When we acknowledge challenging circumstances and validate the concerns of others, we meet them where they are and build trust. We can also help others feel inspired or more confident by sharing success stories of others who have overcome similar challenges. Importantly, we must always be mindful of situations when we need to practice risk management, call on a supervisor, or report to appropriate authorities. It's our professional and legal obligation to do what we can to keep people safe in situations involving child abuse, suicide ideation, or other types of imminent harm. If you are unclear on state laws, protocols, or rules at our affiliate, ask your supervisor for more information. Open the door means inviting people to return to Planned Parenthood and conveying that we are here for them no matter what. By discussing the range of services and programs we offer, we serve as ambassadors, raising awareness of all the great work our organization does in healthcare, education, and advocacy. Encouraging those we are serving, whether a patient, community member, or coworker, to be in touch with questions and concerns tells them we are accessible and here to help. Doing so means they will be more likely to contact us if a problem arises. Finally, always thank the individual for choosing Planned Parenthood. Whether they came to us for medical services, education, a job, to make a donation, to volunteer, or as a trusted vendor, we want them to feel good about their decision to trust and work with us. If we all demonstrate these service standards with every person, every time, think about what an incredible place Planned Parenthood would be to work, to volunteer, to get health care, and to receive education. Imagine the possibilities. Thank you for participating. Please click Exit at the above right to close out of the course.